Hello everyone, Nurse Jared here, and I'm thrilled to welcome you back to Nursing Without Notes as we kick off an exciting new lecture series dedicated to diabetes mellitus. Whether you're a nursing professional or a member of the community, diabetes mellitus is a condition you'll encounter on the reg. To ensure a comprehensive understanding, I've broken down this complex topic into a 4-part series. In this first video, we'll begin with a concise overview of diabetes mellitus. We'll explore key aspects such as glucose regulation and the role of the endocrine pancreas, delve into the pathophysiology underlying diabetes mellitus, discuss its causes, and touch upon some of the potential complications associated with this chronic condition. Understanding blood glucose, the vital energy source. Ever wonder why blood sugar is such a big deal? Well, let's dive into it. Blood glucose, often referred to as blood sugar, indicates the concentration of glucose in your bloodstream. This seemingly humble molecule plays a monumental role in your body because it's the primary building block for energy within your cells. The body, in its wisdom, strives to maintain optimal blood glucose levels through a process known as homeostasis. To picture how glucose enters a cell, think of it like a lock and key mechanism at the cell membrane. Here, the protein insulin acts as the key that unlocks the cell, allowing glucose to enter. The body's goal is to keep the blood glucose levels within the range of 70 to 110, though these numbers can vary, so always verify the normal limits based on your curriculum or healthcare facility. Now let's talk about those energy-carrying molecules created partly from glucose. They're called ATP. Short for adenosine triphosphate, ATP is like the cell's currency, used to power various chemical reactions that require energy. Simply put, without glucose, there wouldn't be much ATP, and without ATP, well, life as we know it wouldn't be possible. Most of our ATP is produced through the entrance of glucose into our cell's mitochondria, where it undergoes a process called cellular respiration. Each glucose molecule that participates in aerobic respiration yields a theoretical net total of 36 ATPs. Now, I don't know about you, but that's a pretty good ROI, or return on investment. These biochemical pathways in cellular respiration are crucial for our energy systems. Pro tip: when explaining this to others, especially patients, it's best to keep it simple. Using terms like ATP might sound a bit fancy and may not be easily understood. Remember, it's important that patients grasp that there can be problems that arise at both low and high ends of blood glucose levels. Now let's talk glucose regulation, primarily managed by the endocrine pancreas through 2 hormones, insulin and glucagon. Yes, it's called the endocrine pancreas because it has other functions too, but we won't dive into those details here. However, when it comes to diabetes mellitus, glucose regulation goes awry, leading to acute and chronic complications. Endocrine pancreas. Let's unravel the intricacies of the pancreas and its role in blood glucose regulation. The pancreas, a slender organ that resides behind the lower portion of the stomach, while it functions as an exocrine gland, our focus here is on its endocrine functions, particularly in the context of diabetes mellitus. Within the pancreas, there are clusters of cells known as pancreatic islets. These islets harbor 2 crucial types of cells, beta and alpha cells, which are pivotal to our understanding. Beta cells, constituting about 75% of the pancreatic islets, are responsible for secreting insulin when blood glucose levels rise. Insulin is a key player in glucose utilization within the body. It acts as a metaphorical key at the cell membrane, unlocking it to allow glucose, accompanied by potassium, to enter the cell. But balance is key in life, and so is it in blood sugar regulation. When blood sugar levels drop, the alpha cells come into play. Alpha cells produce a hormone called glucagon, which prompts the release of glucose into the bloodstream and discourages cells from taking up the glucose already in circulation. Now, let's explore how these hormones work together. Imagine a scenario where a person's blood glucose levels have spiked, possibly due to consuming a carb-rich meal. In response, beta cells release insulin into the bloodstream. This insulin signal encourages body cells to take up glucose from the blood for cellular respiration, inhibits glycogenolysis, where glucose is stored as glycogen in the liver, and inhibits gluconeogenesis, where amino acids and glycerol aren't converted to glucose in the endoplasmic reticulum. Consequently, blood glucose levels drop, returning to the normal range. Conversely, if someone hasn't eaten for a while and has engaged in vigorous exercise, resulting in low blood glucose levels, let's say 50, the beta cells take a back seat and the alpha cells step up to the plate by releasing glucagon. Glucagon inhibits body cells from taking up glucose, stimulates glycogenolysis, breaking down the liver glycogen into glucose, and triggers gluconeogenesis, converting amino acids and glycerol into glucose in the endoplasmic reticulum. This concerted effort by alpha cells elevates blood glucose levels, bringing us back within the defined limits. In essence, the pancreas, with its beta and alpha cells, orchestrates this intricate dance to maintain blood glucose levels within the delicate balance of homeostasis. Quite a roller coaster, huh? Alright, to start learning diabetes mellitus, let's start out by making a mind map. That way we're able to visualize the information. That way we can start drawing connection and thinking about the material more like how our minds work in a network type fashion, rather than in a linear fashion like you see in textbooks or in your notes. By doing this, we'll make more of a connection with the material than when we're studying isolated facts on flashcards. We'll be able to see how all this material kind of fits in with each other, and you'll have that visual in your mind when you go to start getting into the tedious details of the information, because you've worked through a mind map and put it down on paper, and you've done it in a way that how you see the material. And then that's the big benefit of this. I was totally against mind maps when I was in nursing school. And it wasn't until the latter part and toward the end I really began to see the benefit of them. Since then, I've been using mind maps a lot. And I'm telling you, it's really taken my study into a whole nother level. By doing these mind maps and visualizing the information, this information is going to stick with you so much longer because you took the time up front to really draw out the topic and all the material and make connections, visualize everything. And because you took the time to really think out and work through how all the material fits together, it's going to make your active study sessions that much easier because you've already got this topic and this knowledge already drawn out and placed somewhere where you can reference, and you see it in your head and you've already made these connections. Now, this is where I really want you to follow along with me, because this is where you're really going to solidify that knowledge and make those connections by just working around and thinking about the material, moving it around in your head, moving it around on the paper. And so when you first start doing this, it's going to feel a little bit difficult, and you want to feel that. That means you're really thinking about this information. Think about if you go to the gym. If you lift 1 pound weights, you probably aren't going to feel anything, and it's going to be real easy, and you're probably not going to get a lot of results from that. But you want to lift just enough weight that it's going to be putting resistance against your muscles at a little bit more than what you're used to. That way you can start building more mass. And just like those muscles in the gym, your brain works the same way with this material. So if you really challenge yourself to home in and then make these connections and see where it's at, it doesn't have to be perfect on this page. It just has to make sense to you and how you see the material and organize it in a way that makes sense. So I'm going to walk you through how I'm going to make the map, but feel free to do it any way you'd like. Just be sure you're working with the knowledge, and that way you're putting these pieces together, and you don't even have to do it as in-depth as me. You don't have to get very detailed if you don't like, so long as it's making sense in your head that you know where the connections are at. That's what's going to make all the difference in the end. Not how beautiful you can make it, not how many words and pictures you can add, but how it makes sense and how it ties together to the broader knowledge and to different pieces. And you want to start making all these pieces connect. And to do that, a great way to start is by just putting it down on paper. And I know it feels a little weird at first if you're not used to it, but I promise you, if you just bear with me and give it a little bit of a chance through this lecture series, I think you'll start to see how much more you retain by just working through and putting it on a canvas, and then really solidifying that knowledge when you get into the flashcards and it really nails down those specifics. So when you're mind mapping, you want to start with your central idea. And today, we obviously are going to be dealing with diabetes mellitus. And you know, just for the sake of being aesthetic, let's add in a little piece of candy there. And to stay consistent with the rest of the videos, let's choose this light orange color here. All right, diabetes mellitus. Now, the next thing I want to think about when I'm making this is when I'm visualizing this information, everything that comes below has to stem from something that's happened. Something up here is making something relevant down here. Because if we didn't have something going on up here, then we wouldn't be worried about diabetes mellitus to begin with. Now, one of the major themes that we're thinking about here with diabetes mellitus is glucose regulation. So let's just put in glucose regulation. So specifically with glucose regulation, we're thinking about the endocrine pancreas and its endocrine functions concerning the two cells, the beta and alpha cells. So let's put in the endocrine pancreas. And then we know that the endocrine pancreas has alpha cells and beta cells. And specifically, the alpha cells release glucagon, and the beta cells release insulin. So now that we've started to visualize the information, let's go ahead and get Anki pulled up and start creating our diabetes mellitus deck. That way we can start making cards over the specific details as we go along as well. Now let's begin by creating our diabetes mellitus deck by hitting create deck. And we're just going to do diabetes mellitus. And then I'm going to hit Windows key period and pull up our emoji keyboard. And then I'm going to add in this candy again. And then I'm going to hit OK. Okay, now we've created our new deck. And to make subdecks, what we're going to do is we're going to click on this and then drag it down to where it underlines here under Nursing Without Notes, and then we're going to let go. And now that's going to put that diabetes mellitus deck underneath the Nursing Without Notes deck. All right, we're going to click on diabetes deck. Now that we're in our diabetes mellitus deck, let's go ahead and hit add. And we're going to use the close deletion today. And we are in the diabetes mellitus deck. And before we get started, let's go ahead and add our tags in. That way we'll be able to search for these specific cards if we ever want to make a custom study session in the future. So I'm going to denote diabetes mellitus as DM, add that tag, we'll do diabetes, and we'll just do glucose for fun. Now that will leave us with 3 tags for our cards here. We're going to toggle our sticky on down here, and I'm going to take a screenshot of our beta cells PowerPoint slide. I'm going to add it down here below. And let's make ourselves a question. What cells in the pancreatic islets respond to elevated blood glucose levels? Those would be beta cells. And I'm going to double click here. I'm going to close that off. Now also what I like to do while we're at it is I'm going to turn this toggle sticky on as well. And then I'm going to put in the topic at the very top of the card, and we're going to keep them there the entire time. So whenever I'm seeing my cards, I like to have the broad topic at the very top. That way when I'm answering the specific questions, I at least kind of have an idea of what it is we're talking about. So diabetes mellitus. I'm going to go ahead and add that candy in there because it looks good. And I'm going to double click all that, and I'm going to hit Control B and then go ahead and bolden that. And then there we go. What cells in the pancreatic islets respond to elevated blood glucose levels? And those would be the beta cells. All right, I'm going to hit that. We're going to add that card in with Control Enter. Now, when I added that card, you'll see here that everything in these fields remained because I had on the toggle sticky. And then I want that because I wanted this diabetes mellitus up here to stay. That way I can just change this text here for the next card. Now you'll see down here, this leaves the picture here as well, and that's in case you want to make multiple cards having that same picture on the backside. I'm going to take that out and then get a screenshot of our insulin. So what protein does the beta cells in the pancreas secrete to lower blood glucose? And that is insulin. Go ahead and double click that, add that card in. So as we've just learned, potassium moves into the cell along with glucose when insulin acts upon the cell membrane. So let's go ahead and write something that's going to remind us of that. So that's going to kind of give us a heads up to think like, okay, if we give somebody insulin, that might also lower their potassium levels as well. Moving right along, we've got the alpha cells. Take a screenshot and put that in the back. All right, so to remember the alpha cells and that they produce glucagon and then they raise blood glucose levels, and they usually respond to when there's decreased blood glucose levels as well. Let's go ahead and say what cells in the pancreatic islets respond to decreased blood glucose. And that's going to be our glucagon. And the good thing about doing this is when we go to answer these questions, when we do our flashcards, we're going to have this piece of information down here below on the back extra side. And then also you can go ahead and plug in like different screenshots of text or copy and paste in or write in other pieces of text that you find helpful as you're studying. So be sure to do that. If you have some other information that it's going to help you remember it better, or you want to read around it and then add that in, if you want to go ahead and add in some more supplemental information that can really kind of bolster your knowledge in that department, by all means, add more stuff here. And you can either add another picture, more text, anything will suffice, so long as it's beneficial to that knowledge. Pathophysiology. Now let's delve into the core of diabetes mellitus and decipher what's truly transpiring within the body. Diabetes mellitus emerges from a malfunction in insulin production and secretion, coupled with the responsiveness of target cells to insulin. This intricate dysfunction can be categorized into two main types, type 1 and type 2 diabetes. Let's explore each in detail. Type 1 etiology. Type 1 diabetes has an autoimmune origin. It arises from an abnormal immune response that leads to the immune system to target and annihilate the beta cells. Consequently, this leaves the individual incapable of producing insulin. While type 1 diabetes can manifest at any age, it predominantly emerges in children, formerly earning it the moniker juvenile onset diabetes. Although specific genetic factors play a role in predisposing individuals to type 1 diabetes, there appears to be a complex interplay between these genetic elements and environmental factors, such as viral infections like mumps. Despite ongoing research, the precise causes of type 1 diabetes remain elusive. However, it's essential to highlight key takeaways about this condition. Here are a couple high-yield facts. Patients with type 1 diabetes have no insulin production. Also, lifelong insulin therapy is imperative for managing this condition. Type 2 etiology. In contrast, the development of type 2 diabetes follows a distinct trajectory. It typically evolves gradually over an individual's lifetime. This type of diabetes is characterized by a progressive deterioration stemming from insulin resistance, ultimately resulting in reduced insulin secretion. Insulin resistance, a pivotal factor in type 2 diabetes, emerges as a consequence of dietary choices, physical inactivity, and in some cases, genetic predisposition. This resistance to insulin's effects often precedes the onset of type 2 diabetes, and frequently co-occurs with cardiovascular issues like hypertension and hyperlipidemia. Similar to type 1 diabetes, the precise causative factors of type 2 remain unclear. Nevertheless, the presence of metabolic syndrome has been identified as a significant risk factor for its development. Metabolic syndrome comprises a cluster of 5 conditions that elevate the risk of heart disease, diabetes, stroke, and other health complications. A diagnosis of metabolic syndrome is made when an individual exhibits 3 or more of the following risk factors. Hypertension. Indications include a blood pressure reading exceeding 130/85 or the use of antihypertensive medication. Low HDL, or high-density lipoprotein. In males, low HDL levels are defined as less than 40, while in females, it's less than 50. High triglycerides. Triglyceride levels at 150 or higher, or the use of lipid-lowering medications. Increased fasting glucose. A fasting blood glucose of 100 or higher, and or the use of anti-diabetic medications. Large waist circumference. A waist circumference measuring 40 inches or more in males and 35 inches or more in females. The presence of any combination of 3 of these risk factors heightens the likelihood of developing diabetes and is believed to contribute to insulin resistance. So now we've got our diabetes mellitus, we've got glucose regulation, that's pretty much the central theme. There's problems with insulin. We're having problems specifically with blood glucose regulation. So let's go ahead and add in the pathophysiology. And let's denote that in red because that's going to signal that that's not what we want going on. Let's go ahead and put in pathophysiology. And we know that there is type 1 and type 2 diabetes. So now we got type 1 and we've got type 2. So type 1, the high yield facts that we need to know is there's no insulin present. And then also there's lifelong insulin therapy. So these are the two high yield facts that we need to know about type 1 diabetes. All right, now with type 2, we've got a couple things going on here. It's progressive, has a lot to do with insulin resistance, and then also we've got the metabolic syndrome. All right, so here with metabolic syndrome, we've got 5 things that we really need to think about. And those are going to be our hypertension. Let's add in our heart here. Hypertension, low HDL, increased triglycerides, increased fasting glucose, and then also waist circumference. All right, so we're coming out nicely here. We've got our glucose regulation with our endocrine pancreas, our alpha and beta cells. And so we got our type 1 and type 2 up here now, and just with a couple high yield facts, just seeing how this all ties together. And up here with insulin, let's denote insulin as the key, because it acts as like the lock and key mechanism on the plasma membrane. And so that's the pathology, and it's all centered kind of around this glucose regulation, and we're having complications with the blood glucose concentrations, which is resulting in our cells not getting the adequate ATP that we need. All right, so now we're moving on to the pathophysiology. I'll put up here pathophysiology that we got next, and I'm going to just italicize that and then I'm going to put that text in red, I believe. We'll do it like that. Yeah, pathophysiology. All right, let's get a screenshot of our type 1 diabetes. Now we've got the pathophysiology up here underneath the diabetes mellitus to let us know we are going to be quizzing ourselves over the etiology. And so type 1 diabetes comes from the autoimmune disorder in which the beta cells have been attacked and are no longer secreting insulin. So let's ask ourselves, what origin does type 1 diabetes have indicating its cause is linked to the body's defense system? Autoimmune origin that results in the destruction of the beta cells causing no insulin secretion. All right, that's going to be good. We'll add that. Now let's erase that. Now that we have that erased, we see the benefit of having these toggle stickies is because now we can keep making questions with the pathophysiology in mind and then not have to retype and then redo those colors and then redo the emoji and do all this bold stuff up here. So it just makes it really fast and convenient. And it makes our cards look nicer too. All right, so the other high yield fact that we really need to commit to memory is the fact that since they have no beta cells that are functioning properly, that they are going to be on a lifelong regimen of insulin. With that said, let's write a question here. So what kind of therapy is essential for managing type 1 diabetes due to the absence of insulin production? And that is going to be insulin therapy All right, insulin therapy due to the attack on the beta cells by the autoimmune disorder. So by adding in just that bit more information, this will further remind us that, okay, the beta cells are the ones producing the insulin. They have been attacked. They're not functioning properly. Therefore, the patient is always going to require insulin therapy. So this will be something that can't be managed by diet and exercise. So individuals with type 1 diabetes will have a lifelong insulin therapy due to this attack on beta cells and there not being proper insulin production. So I'm going to double click there and highlight all that, and then hit our Control-Shift-C. And now let's Control-Enter and add that card in. All right, so now we've really kind of touched on the high yield information we need to know for the type 1 diabetes etiology. For the rest of the type 1 etiology, the environmental factors such as the viruses, and then also there's certain genes that make the patient more susceptible. So let's go ahead and make a card to just remind us that the environmental factors and the susceptibility genes are the potential causes for type 1 diabetes. And then that way we can just be reminded of that. And then also that will spark that autoimmune response to even further our knowledge. That way we don't forget. All right, so what are the suspected causes of type 1 diabetes? And you know what, just for the sake of it, let's bold that. All right, so environmental factors such as viruses like the mumps. I'm going to Control-Shift-C here and make one close. And then also there's certain genes that are susceptible. All right, susceptibility genes. Okay. All right, we'll highlight that. Control-Shift-C, and we'll make our second close. Now we want to answer this all together, and so we'll just do 1 and 1 to give us we'll just do 1 and 1 to give us one card for both these answers. All right, so we'll Control-Enter, and we'll add that card in. Now we're done with type 1 etiology, and let's move on to type 2. All right, let's move to type 2. I'm going to grab a screenshot of our PowerPoint. That way it'll give us visual reminders. So with type 2, it's a gradual progressive disorder that is characterized by insulin resistance. So let's add us a card in there about that. All right, we'll double click there, Control-Shift-C, and we'll make our card with that and Control-Enter. Let's get rid of that. And so insulin resistance seems to be one of the pivotal factors that emerges in type 2 from, dietary choices, physical inactivity, and sometimes, there's some genetic predisposition. So let's make a card on that. What is a pivotal factor in type 2 diabetes that emerges due to dietary choices, physical inactivity, and sometimes genetic predisposition? And that's going to be the insulin resistance that comes about in type 2. And so we'll Control-Enter, and we'll add that to our deck. One of the high-risk factors that places an individual at high risk for diabetes is the presence of metabolic syndrome. And that comprises of 5 different things, and there's a diagnosis if there's 3 or more. So let's go ahead and put in what we know about metabolic syndrome. That way we can know when we're looking at patients and looking in their chart and their history, or see it on a test, looking through MR or an EHR, we'll be able to determine, okay, well, this is going to place that person at a higher risk for type 2 diabetes, and maybe you can start being able to draw some conclusions about what might be going on with their health. With that said, let's make a question about the metabolic syndrome. Let's use this question to remind us of metabolic syndrome. Even though the precise causative factors of type 2 diabetes remain unclear, what has been identified as a significant risk factor for its development? And the presence of metabolic syndrome is going to be the answer to this. And so let's go ahead and add that in. Control-Enter. Now let's ask ourselves, what are the components of metabolic syndrome? Let me grab a screenshot of our metabolic syndrome, and we'll place this down here. And let's ask ourselves, what are the 5 factors in metabolic syndrome? And let's bold that up. So because you'll see metabolic syndrome thrown around a bit throughout nursing school, let's go ahead and tag these cards specifically. And so we can, if we ever want to make a deck or a custom study deck over just metabolic syndrome, we'll be able to search that in our tags. Metabolic syndrome. I'm going to paste in our 5 factors. Actually, what are the 5 conditions in metabolic syndrome? All right, so here's where some people would say, test yourself over the whole thing, or maybe test yourself on just a couple of these things. So I'll show you the way I approach this, where you can test yourself over this entire card, but also give yourself some hints. So for the first one, hypertension, we'll go ahead and just take that completely, we'll close that completely out. So here's a little trick on how to test yourself on all 5 pieces of information. So instead of covering this whole thing, let's take HDL and cover just that. And Control-Shift-C, and we'll do the same thing here. Now let's come back and let's change all these to 1. All right, so now we're going to see that all as one card. But when we go to answer all 5 conditions, we're going to see that low, high, increased, and large. And that's going to be able to spark our memory just a bit more, and we're not going to have to dig out every little bit of that. And then that way we'll still have to know what is low and what is high. After that, we'll go ahead and make individual cards over all 5 that specify what determines if it's high or low. But this way you can get a broad overview of the 5, and then also when you flip the card over, you got this nice little chart that shows up below in the back extra. So let's go ahead and add that in. So to be diagnosed with metabolic syndrome, you just have to have 3 or more of those factors. So let's remind ourselves of that. Now we've got how many of the listed risk factors must an individual exhibit for a diagnosis of metabolic syndrome? And our answer is going to be 3 or more. So this card is going to be a perfect reminder of what we need to look out for with metabolic syndrome and how many of these factors need to be exhibited for an individual to be diagnosed with metabolic syndrome. And then also too, we'll be able to see the entire chart below in our back extra field down here. So let's add that to the deck, Control-Enter. Now that we've got metabolic syndrome noted and how it's diagnosed, now let's go through and make individual cards defining what each of those factors are. Let's get rid of this, and let's take it from the top with hypertension. So our hypertension is going to be anything that's over 130 over 85 or taking antihypertensive medications. What blood pressure reading is considered an indication of hypertension in the context of metabolic syndrome risk factors? And that's going to be exceeding 130 over 85 and or taking antihypertensive medications. So we'll jot that in. Next up we have low HDL. So let's make cards defining what that is for both males and females. So for males, what level defines low HDL as a risk factor for metabolic syndrome? You know what, I want to bold that. And let's highlight that to indicate this is what we're really looking for. So less than 40 is what it is for males. Add that in. For females, what level defines low HDL as a risk factor for metabolic syndrome? So let's highlight that real quick and bolden that. And then less than 50 is what defines low HDL for the females. Let's add that in there. So now we've taken care of hypertension and we've got low HDL. Next up is going to be our high triglycerides. What is considered high triglyceride levels in the context of metabolic syndrome risk factors? So let's go ahead and highlight that. We'll bold metabolic syndrome. 150 or higher, or medication for the high triglycerides is also going to be. So to be considered high triglyceride levels, they're going to have either 150 or higher or be on medication for their triglyceride levels. All right, so let's add that. Now next up we have our increased fasting glucose. What is considered an increased fasting glucose level in the context of metabolic syndrome risk factors? let's highlight increased fasting glucose. And a fasting blood glucose level of 100 or higher is going to be what's considered the increased fasting glucose level to be considered positive for one of these factors for metabolic syndrome. All right, let's add that. Control Enter. And last but not least, we have our waist circumference. All right, for males, what waist circumference measurement is considered a risk factor for metabolic syndrome? 40 inches or more. Let's add that to our deck. For females, what waist circumference measurement is considered a risk factor for metabolic syndrome? And that will be 35 inches or more. And we'll add that to our deck. And I'm going to grab a screenshot of our insulin resistance slide. That way we can make a card over insulin resistance and we can remind ourselves of what that actually is. Because a lot of these terms get thrown around when you're first learning this stuff and you're like, okay, well, insulin sensitivity, insulin resistance, what is all this? So let's go ahead and jot down a card. What is a reduced cellular response to insulin that develops from diet and physical inactivity with possible genetic susceptibilities? And that is our insulin resistance. And we'll go ahead and double click there and Control-Shift-C. And then we've got our slide on the back side of it, and we'll go ahead and Control-Enter, add that to our deck. Chronic complications of diabetes mellitus. The chronic complications associated with diabetes mellitus can be categorized into two main groups, macrovascular and microvascular complications. While delving into the pathology of these processes over time can be quite intricate, it's crucial to grasp the broader understanding of what occurs. At its core, the presence of elevated blood glucose levels in the bloodstream triggers a process called non-enzymatic glycation, wherein glucose molecules bind with proteins and lipids. This glycation process generates highly inflammatory molecules, which in turn give rise to deposits of low-density lipoproteins, or LDL. This ultimately fosters atherosclerosis. Additionally, these deposits can accumulate in the vessels and surround their basement membranes, leading to a condition known as hyaline arteriosclerosis. The overall effect of these processes results in reduced perfusion to distal tissues and impaired gas exchange, consequently contributing to both macro and microvascular complications. Macrovascular complications encompass cardiovascular disease, cerebrovascular disease, and compromised immunity and healing. These plaques can accumulate in coronary arteries, potentially resulting in a myocardial infarction. Peripheral arteries may also be affected, leading to peripheral vascular disease, and in severe cases, diabetic foot ulcers. In instances where these plaques form in the brain's blood vessels, they can trigger ischemic strokes. The elevated glucose levels, impaired gas exchange, and compromised white blood cell function collectively reduce immunity, raising the risk of infections and delayed wound healing. On the other hand, microvascular complications encompass nephropathy, neuropathy, and retinopathy. Notably, the glomeruli in the kidneys are susceptible to plaque development, leading to a condition known as Kimmel-Still-Wilson nodules. This condition results in excessive albumin excretion, hypertension, and eventually end-stage kidney disease. It's also worth mentioning that diabetes is the leading cause of end-stage kidney disease in the United States, emphasizing the importance of annual urine analysis, BUN, microalbumin, and creatinine blood levels. Retinopathy emerges as blood flow to the eyes become restricted due to these plaques, causing retinal hypoxia and the appearance of cotton wool spots. Unfortunately, diabetic retinopathy often remains asymptomatic until vision loss occurs, underscoring the significance of annual eye exams to safeguard one's vision. High concentrations of sugar can also damage nerve cells, resulting in diabetic neuropathy. This condition impairs sensory nerve fibers, leading to a lack of sensation when individuals sustain cuts or injuries to their feet. Reduced blood flow and elevated blood glucose levels further exacerbate wound healing issues, creating an environment conducive to bacterial growth. Consequently, diabetic foot ulcers can develop, with severe cases potentially necessitating amputation. Now let's come back to our mind map. These are our acute complications, so let's go ahead and start talking about our chronic. And chronic is divided into our macro and microvascular. So this is going to be our cardiovascular disease, cerebrovascular disease, and because of this glucose, we're also going to be seeing some reduced immunity and some of that lower functioning of the white blood cells. Jumping back over to Anki. So this card here, we probably could do without because we're going to know there's macro and micro, but it can be a really quick card, and if you don't end up using it, just suspend it, but I'm going to add this in here. The chronic complications associated with diabetes mellitus are mainly categorized into two which groups, macro and microvascular complications. So I'm going to add that in there. And I also want to add in these more technical cards too. What process is triggered by elevated blood glucose levels where glucose molecules bind with proteins and lipids? This is that non-enzymatic glycation. Deposits can accumulate in the vessels and around their basement membranes, leading to which condition? This is hyaline arteriosclerosis. This is what's causing a lot of these complications, is that all these vessels are getting blocked off, causing major complications. Now, you're probably not going to see this on a test, but I think it's really nice to know because it keeps you thinking about the physiological processes behind what's going on and why we're providing the care we are. So let's add that in. What are the main types of macrovascular complications associated with diabetes? That is our cardiovascular disease, cerebrovascular disease, and compromised immunity and healing. You know, but I don't want to actually, let's change this. All right, let's close off 3 individual ones. And we'll leave compromised out in the open, so it'll give us a little bit of a reminder. All right, now let's add that. Control Enter. Back to our mind map, let's go ahead and add on our microvascular complications. We'll add in the kidney beans for nephropathy. And we can add in neuropathy. And we can add our brain emoji in, that'd be nice. And lastly, we can add in retinopathy. And I'm sure we can put an eyeball in there. There we go. I think that looks nice and neat. All right, so we're starting to see this bigger picture about kind of like the overview of what's going on here with diabetes. And this is allowing us to just kind of make those connections and see this material in this network fashion and not that linear type in the textbook. You're not going to be able to remember every little detail of this, but it's going to help you visualize this, and you can be able to start picking apart and then tracing over to these little bitty areas of where you're making your map. So when you do go to answer these cards, you're going to be able to kind of trace in your mind. You're like, oh yeah, I kind of see where that's at and where it fits into this picture. It's just solidifying that knowledge more by drawing it out in this way. And I think it looks kind of neat too. And it's pretty rewarding too once you get all through it and you've got a big, nice map. And I don't know, I think it's kind of nice. All right, let's go back to Anki. And I'll grab our screenshot of our microvascular. Microvascular complications primarily encompass which 3 conditions? All right, let's add that. Now we can add this card in over Kimmel-Still-Wilson nodules or nodular glomerulosclerosis in the context of kidney-related complications. What conditions result in excessive albumin excretion, hypertension, and end-stage kidney disease? And those are those Kimmel-Still-Wilson nodules that we talked about that build up in the glomeruli of the kidneys due to those increased deposits around those membranes. You might come across this on a test. The diabetic retinopathy's appearance in the eyes due to restricted blood flow is often characterized by which type of spots. That'll be the cotton wool spots. Add that. What condition damages nerve cells due to high blood glucose concentrations and results in impaired sensory nerve fibers? And that's going to be the diabetic neuropathy. And we'll add that in to the deck. High blood glucose levels and reduced blood flow can lead to the development of which severe complication in the foot? And that is going to be our diabetic foot ulcers. We'll add that in. Now lastly, on our complications, in extreme cases of diabetic foot ulcers, what procedure might become necessary? And this is unfortunately when you start seeing those amputations of toes and feet in individuals with diabetes mellitus. And we'll go ahead and add that. Now you can see we've got 32 brand new cards here in our diabetes mellitus deck. And we look in the browse function, we can see that we've got all these beautiful brand new cards. So be sure on the back extra of these cards to go in and add any additional information that you find necessary that's going to help build your knowledge around this material. I'm just adding the slideshow in for you so you'll have that if you download the deck. Also use these same strategies to make cards around the material you're covering in class that I may have not covered here on this video. Use the images to also give you more visual cue to this information. Now we're done with part 1 of this 4-part series. Now that we've got those beautiful new cards made, I want to take a screenshot of this. And eventually I want to add the whole map in, but just for now, let's take a screenshot of this and let's go back to our cards up top. And I'm going to add in a picture of our mind map below on these back extra fields to give us a little bit more information. We'll be able to look at this mind map again as well. That's going to spark our memory about how we've been working with this material. I know this is a little tedious, that's why I'm doing it for you all. I just want to show you how you can get the most out of this back extra field. That way you're seeing that beautiful mind map that you've created. That's going to spark all that information and memories on how you've tied it together as you are working through with it. And I know this isn't a very easy process, but this is how you solidify that knowledge and really get it ingrained in your mind and really understand what's going on with the topic. All right, so now we've added in that beautiful mind map in the back extra column of these cards as well. Now when we go to flip these cards over, not only will we see the supplemental information along with the PowerPoint, you're going to see this beautiful mind map now that's going to spark all those connections to that information while you are working through it. And by doing this, now you're going to really be able to start seeing this information from a bunch of different angles. That way you're getting the most bang for your buck out of your study time. It's a little bit tedious, yes, but by doing this, you know you're not wasting your time studying. You're actually getting in there, you're working with this information, and it's not very passive. You're really trying to move these pieces around, see how they fit in, and that way you're going to be able to hold on to this for the long term and not just study and dump. Because you remember, we do have the NCLEX we have to take as nursing students at the end of it all. And by using Anki, this is going to stay with us the entire time, and we can always reference back. In that way, by the time the end of the nursing program comes around, ostensibly, you'll have already been studying everything from the beginning, and you won't be overwhelmed, and you'll be ready to crush that NCLEX as soon as graduation comes around. All right, well, that's part 1. We've got a beautiful mind map underway. We're starting to build those connections and see this material just kind of unfold on the page. We've got a really good start to our Anki deck that's really kind of focusing in on those specific details to help us remember what it is we're learning. And by the way, if you're finding all this very beneficial and you want to dive deeper into this, click on that link below in the description for further information. All right, well, that's going to conclude part 1. I look forward to seeing you part 2 when we start going over those diagnostics and the clinical manifestations. Well, that wraps up part 1 of the series. You're doing awesome and keep up the good work. And as always, if you're finding these videos helpful with your studies, be sure to like and subscribe and also share with a classmate. And I'll see you in that next video.